Hi, my name is Dana Wenzel, and today I will be demonstrating how to take vital signs. What are vital signs? Well, vital signs are very important. It's the clinical measurements of the pulse, heart rate, temperature, and respiration. And what is the importance of vital signs is to make sure that good condition, if the body's natural basic functionings are working properly and they measure to make sure that it's not poor condition. So the required equipment that we are going to be using is a stethoscope, a blood pressure cuff, and a thermometer. And last but not least, I'm going to use my phone as a stopwatch to record. Vital signs are the most essential part of the physical examination. Vital signs are used to assess the basic body functions. The act of taking vital signs, as I mentioned before, are temperature, pulse, blood pressure, and respiration rates. There are other things, but those are the four main basic ones that we can do even at home if you're not in the health profession. So I'm going to begin with the temperature. This is a thermometer and it is used, you can use it various ways. Some people use it to panic, stick in the ear. There's another one that's you just press in the ear. There's blood pressures for across the forehead. But the thermometer I'm going to use is oral. There's also other areas you can use under your arm, which we call axillary or rectum. So the oral one, most people like to stick it right under their tongue. However, healthcare professions, we usually get more of an accurate reading if it's near the buccal, which is your cheek, inside between there and the lateral side of your tongue. So I'm going to begin, and I'm going to stick it in my mouth. And you use it, and it records about a minute. As it varies, temperatures, I like to say, according to also as vital signs, it varies by age. We have a category for infants and newborns, adolescents, younger children, and then older adults, and then regular age. So temperature, far as the temperature is concerned, believe it or not, 99 is not a fever. It is a normal temperature. The textbook standard is 98.6, but 99 is considered normal range as well. We, in the healthcare profession, if you have a fever and you're an adult, 101 is considered a fever. If you are a child, it would be 100 Fahrenheit. They're also measured in Fahrenheit or Celsius. Healthcare professions use either or, and then there is a conversion that you do if you want to get to Fahrenheit or Celsius. The next thing that we are going to do is measure the respiratory rate. Now I'm going to stand up here firm. When a person is breathing, they should be breathing natural expansion and inspiration and expiration chest. If you find somebody using what we call accessory muscles, more breathing right around the rib area, go, that is an abnormal. Some people, which we say apnea, is considered shallow breaths. So the normal breath that for 1 minute we measure is 12 to 24. If anyone's below, it's considered apnea. If anyone is above 24, increased respirations can mean that they are in acidosis and they have too much carbon dioxide in their bodies. So for a minute, we would naturally just see. And we wouldn't let the patient or the person to know, because if they know they're being watched with watching the respirations, they will tend to increase breathing. They'll breathe more. So as healthcare professionals, what we do is usually when we do the pulse, measure the pulse, we'll naturally look at the lungs as well. So that concludes my next one. The radial one, what we do is we take our 2 fingers for the pulse and we put it on the radial vein here. Sorry, my dog Lucy wants to be a superstar. And we measure for 1 minute. There's different ways. If you count for 15 seconds and times that by 4, or count by 30 seconds times that by 2, or the most one is the full minute. So you take your 2 fingers and make sure it's not your pulse, which would be in your thumb, and you just click on, you find the radial. And then we ask ourselves, is it beating normal while we're doing it? Is it thready, or is it bounding, or irregular? Because that will indication if there is some heart problems. And pulse-wise, the reason why we do pulse as well is to make sure that it's the physical expansion of an artery. So the most accurate one, it would be the apical pulse, and that is right here. Suggest we would take our stethoscope and we would put it right here of our heart, and we would go for 1 minute, and we would check and then count. But however, as professionals at home, or I mean, as anybody at home, what we do is we just go ahead and we count it for a minute. So the normal is 60 to 100. Below 60 is considered Brady. Above 60 is considered tachycardic. So for now, finally, for the blood pressure. So the blood pressure here, what we would do is we would find the brachial artery, and we would put it right here and above it, slightly above. Then we would take our stethoscope and we would place it under here. We would take the gauge and the bulb, and we would count it up to a normal one is up to 180. And when we're doing that, we go up to pump up to 180 if they're normal general health. And then we slowly release the release button knob over here. And what that does is the first thump that we hear, we would record that as the systolic. And the systolic is the contraction of the heart contracting. Then the last thump we would hear is the diastolic, which means the heart is at rest. And we would like to know, normal is 120/80. If it's any indication of prehypertensive, it's 140, hypertensive is 150, and it goes up. And that is early signs of detection of heart disease. I'd like to conclude with monitoring vital signs are commonly include, like I said, the heart rate, the blood pressure, the pulse ox, and the respiratory rate. The importance of monitoring will inform healthcare professionals the changes in the patient's general condition. Thank you.